Good morning, ma'am, sir. I'm Kevin S. Balumaga from BSN 1D, and I'm here to demonstrate or to assess the musculoskeletal of a patient. Let's proceed. First, I'll proceed by hand hygiene and gloving because we will touch the patient. I have here all the materials that I'll need in this procedure. Alcohol. Earlier, I already provide privacy to the patient by closing the door, windows, curtains, and blinds. Then we will greet the patient, introduce ourselves, and identify the patient. Good morning, sir. I'm Kevin, your student nurse for today. Can I know your name and your birthday, please?
February 15, 2005.
Check lang po yung wrist nyo. Okay. So, I'm here po to assess your musculoskeleton. So, yung procedure po ito is utusan ko po kayo na gawin yung certain activity na gagawin natin para ma-make sure na kaya nyo pong igalaw yung katawan nyo, okay? Now, if you feel any pain po or discomfort, you can tell me po para magawa natin ang paraan. Sir, okay? Now that I identify the patient, we'll proceed by assessing the patient. Sir, tayo po. No? By inspecting the skeletal and external alignment of the vertebrae patient. That's one. So, align naman po yung vertebral ni patient. So, no abnormalities have seen. Di naman po nakagilid yung katawan ni patient, which is sign of scoliosis. Do you feel any pain po pa sa back niya, sir?
Hindi.
Okay. That's good na, sir. So, no abnormalities have seen. Naka-erect naman po yung pagtatayo ni patient. Yung shoulder ni patient is pantay naman. And yung paa ni patient is nakadikit naman po yung paa ni patient. Good sign na, sir. Then we'll proceed by observing the gait of the patient. So, sir, I will assist. Utusan ko po kayo na maglakad towards me and babalik po kayo doon, okay? 1, 2, 4. May dizziness po ba kayo nararamdaman or wala naman po?
Hindi.
Okay, so, smooth naman po yung paglalakad ni patient. Hindi naman po mukhang dizzy si patient or wiggly. Wiggly and rhythmic naman po. Yung kamay ni patient is sumasabay naman po sa kabilang hand ay sa feet ni patient habang naglalakad, which is good. Then we'll proceed by palpating the temporomandibular joint for movement and pain. Sir, I will touch you na po na. Now, I'll ask you po to buka nyo po yung jaw nyo up and down. 1, 2, 3. Laki nyo po. Okay. So, as I observe, mandible movement naman po is okay. Naka-open naman po ni patient yung mandible. And no abnormalities have seen. Yung snapping and clicking naman po. May pain po ba kayo habang open nyo po ba? So, may snapping and clicking po na may nararamdaman po akong snapping and clicking. And no pain po kay patient. So, good naman po yun and normal. Then we'll proceed by assessing the temporal joint range of motion or ROM. So, sir, May gagawin po ako sa jaw ko and gusto ko pong gawin nyo din or ulitin nyo lang po ang gagawin. Okay? And tell me po if may masakit po or pain. Up and down ulit, sir. 1. Laki nyo. Yung hanggang kaya. Okay. So, I want you po to side by side naman po. Kaya po, sir. 1, 2, 3. Side, side. May masakit po ba habang ginagawa niya, sir?
Hindi.
Now, I want you po to erect po. Masakit po ba here? Or wala naman pong masakit?
Hindi rin.
So, no pain po sa range of motion ng jaw ni patient, which is a good sign, sir. No abnormalities have seen. Hindi naman po nahihirapan si patient, and yung pag-open po ng mouth ni patient is to 3 to 6 centimeters. Then, 1 centimeters naman po yung pagigilid or 2 centimeters. 1 to 2 centimeters yung pag side by side. Then, we'll proceed by inspecting. Then we'll proceed by inspecting. We'll proceed by inspecting and assessing the neck of the patient po here. Then what we'll do is you should check muna po natin, check muna po yung no abnormalities have seen po sa neck ni patient. Meron pong dark areas lang po, probably the obesity na, sir. Then we will palpate the trapezius muscle po ni patient. Saan ito ba, sir?
No.
Next, sir.
Hindi.
Okay, so yung neck po ni patient is symmetric, which is naka-align naman po sa katawan ni patient. Then yung muscle is firm naman po in touch, no pain po sa paghahawak or palpate. Then we will proceed by assessing the next range of motion, sir. Now here po is gagawin nyo na po yung gagawin ko. First is inner, then outer. Abduction or down, right? Yeah. Flexion and extension. Then lateral flexion like that, sir. Then the rotation or like that. Okay? Kayo pa. Baba mo na po. Next po muna is like 1. Kaya nyo pa? Masakit po ba here or hindi? Then palikod. Side po ba? Ito, pag-ilit naman po. No, like, ganun po. Masakit pa?
Hindi.
Then next. Masakit pa? Then now, ganun naman po. Masakit po ba?
Hindi.
Here. Kung kaya nyo po. Yan. Kaya nyo pa po ba? Or yung masakit po ba sa likod during the procedure?
Hindi naman.
Okay, for the flexion of the neck of the patient is 45, then the extension is 55. 55 angle po. Then here, kaya niya po yung patient, which is 40 degrees and the rotation is 70 degrees. May pain po ba na nararamdaman, sir?
No.
Okay. Next is we will assess the neck for muscle strength po. Here, sir, I will proceed by gagawin ko po is, ilalagay ko yung hands ko dito, then, yung hulo nyo po is, gigilid nyo pa ganon. Ifo-force nyo po yung kamay ko, okay? 1, 2, 3. Okay, sir. Next po. What's up now? Next is, okay. May pain po ba sa likod niya or sa neck niya pa banda?
Hindi.
Next is we will proceed. Dito naman po na, sir. Hold po po dito. Gagawin ko po is ibababa nyo po yung neck nyo, then lalagay ko yung hand dito, then po-force nyo po pataas. Okay? 1, 2, 3. Yung strength naman po ng neck ni patient is good. Kaya naman po niyang i-force yung hands ko na mag-rotate or upward po, which is good sign na, sir. Full strength po yung ginamit ni patient and your resistance po is bilateral. Then, inspect the shoulder po or cervical, thoracic. Tayo po kayo, sir. Lumbar spine and okay. Then, I want you po, so po kayo, ganun po. Ganun ka, sir. Okay. Then, I'll inspect the back of the patient. Okay, meron. Visible naman po yung spine ni patient. Straight naman po. No signs of any abnormalities like scoliosis, kyphosis, or liposis po. Do you feel any pain here, sir?
Wala.
Okay, nakikita ko naman po yung concave. No? Sir. Then, stand po kayo dyan. Assess naman po natin yung range of motion ng vertebrae nyo, okay? Sir, first nyo pong gagawin is, lalagay nyo po yung kamay nyo sa downward, okay? O yun muna po, 1. Okay, flexion. Downward po, 1, 2, 3. May masakit po ba during the procedure?
Hindi naman.
Okay naman po. Mahilo po ba kayo? Then, lead po kayong ganon hanggang kaya nyo po. Okay, sir. Do you feel any pain po sa back nyo?
No.
Okay. Next is we will side by side naman po, like ganon. Ganon po. Okay, another one. May masakit po ba?
Hindi.
So that's 38. This one po, which is good. Then we will rotate. Here, you'll rotate po by hand po. Okay. Other po. May kasakit po ba sa back during the pag ginawa nyo? Ano naman po.
Ano naman?
Okay. Next is we will palpate na po the posterior neck. Sir, I want you to upo po patalikod, sir. Kaya nyo po patalikod. Tayo patalikod. Check natin yung posterior neck ni patient for spinal process and muscular alignment and fit. Taas ko lang po yung baba nyo po yung kamay. Straight naman po yung vertebrae ni patient, that she's good. May pain po ba, sir?
Wala.
You feel any tingling po ba?
Hindi.
Okay. Align naman po yung vertebrae ni patient as I say earlier po, and no painless naman po during the palpation or assessment. Then, we will proceed naman po sa pagtatap ng spinal process ng patient and tell me po if may nararamdaman po kayong pain. Okay, sir?
Sige.
May masakit po ba?
Hindi.
Sabihin nyo na po, masakit okay?
Oo.
Masakit po ba during the assessment?
Hindi naman.
Do you feel the tingling po ba sa likod nyo or hindi?
Konti.
So, no pain po yung naramdaman ni patient during the tapping or the percussing. So, tayo na po, sir. We'll proceed po by inspecting the shoulder of the patient. Tayo. Likod po kayo. Okay. As I observe, yung shoulder po ni patient is align naman po sila sa isa't isa. And no abnormalities have seen, sir. And symmetric naman po sila. Okay. Now we'll proceed by palpating the shoulder po. Upper arm and firmness or fullness. Ako kaya, sir? May masakit po ba?
Hindi.
There po. Sige po.
Hindi.
Okay, no pain naman po upon palpation, which is good answer. And the muscle po ng shoulder ni patient is firm and full po. Then we'll proceed by test the trapezius muscle strength po, sir. So here po, mag-a-apply ako ng pressure here naman. So tataas nyo lang po yung shoulder nyo upon the strength, okay? Huwag lang po. Hold na po. 1, 2, 3. Okay, sir. So strength naman po ni patient is good. Kaya naman po niyang i-force yung katawan niya sa pag-upward and kaya niya po labanan yung hands ko. And yung pag-rise po ng shoulder ni patient during the test, sabay po sila nagtaas yung shoulder. Then we'll proceed by assessing the shoulder range of motion. Tayo po kayo, sir. Now we will do a flexion, extension, hyperextension po. Here you will ikot-ikot. Wait. First kung gagawin is patalikod. Then pataas ka na. 1, 2, let it 1, and pataas. 1. Sakit ko ba?
Hindi.
The other hand up. 1. Then back. 1. Sakit po ba here?
Yeah.
Okay, for the flexion, 180 degrees naman po yung kaya niya and hyperextension, which is normal na, sir. Then, for the abduction and adduction, I want you po to up yung hands nyo, then lahang pa na. Okay? 1, 2, 3, up. Close yung hand. Masakit po ba?
Hindi.
Downward. Okay. Sakit po ba here? Like may naradaw po ba kayong shoulder nyo?
Hindi.
Okay, so for the abductions, 180 degrees din po. Then for the adduction is 50 degrees. Then we'll proceed by assessing the shoulder for range of motion. Do this, sir. Kaya niyo po ba? Then patalikod po pala. Kaya niyo po ba? May masakit po ba during the assess here sa shoulder niyo? Okay, kaya naman po ni patient yung full 90 degrees na rotation sa shoulder ni patient, which is good. Then, we'll proceed po by the assessing the rotation if may nararamdaman po patient, face the patient. Here, sir, gilid po kayo ganun. Then, I want you to do pataas, then pababa. Pag ganun. 1. Kaya niyo pa. The other hand. May pain po ba?
Hindi.
During the abduction and adduction, wala po bang pain or any abnormalities? Wala naman pa. Okay. Then we'll proceed by sit po kayo, sir. Assessing the arm for muscle tone. Sir, I want you to rest lang po yung hands nyo, then okay. Next. Back. Okay, so nakikita ko naman po na nagre-resist yung muscle location during the here. Dapat po is relax lang yung muscle location. Okay, then other hand. Okay. Masakit po ba?
Hindi.
So, wala naman po nararamdaman si patient during the abduction and adduction, which is good, yes, sir. Then, upon the assessment po, nung nakarelax po yung patient, Nakarelax po yung arms ni patient. I feel ay slightly ano pa, yung pag-resist kay patient, which is good na sir. So, that means meron po siyang assistment kahit na nakarelax. Is good. Then we will proceed by the assessment of arm muscle strength by comparing bilateral. Here sir, I want po na stretch nyo po yung hands nyo. Then I'll apply pressure here na sir. Pagdal ko po ako. Hold the other hand. Taas nyo po ito. Then, i-force ko po pababa yung hands ko. Then, dapat po i-force nyo. Okay? 1, 2, 3. Okay. Kaya naman pa. Then, other hand po, sir. Gusto ko lang po kayo patay. Patay na lang po. 1. So, kaya naman po ni patient na i-force or ano yung deltoid niya. Then, we'll proceed by the triceps, sir. Sir, I want you to do this. Kasi po, okay. One muna po. Then, I'll force po na pababa yung hands nyo. Then, kayo, i-force nyo po siya, okay? 1, 2, 3. Okay, then with the other hand. Okay, so kaya naman po ni patient na i-force yung hands ko during the muscle assessment. So good naman yun, sir. Yung strength po ng hands ni patient is equal to the other hand. And kaya naman po niyang i-full force yung force yung pagpupigil sa hands ko. Then we'll proceed by assessing the bicep naman po. Here, sir, flex po kayo, then bababa ko po yung hands nyo. 1, 2, 3. Refeel nyo po ba yung bicep nyo na? Correct. Okay. Other hand. 1, 2, 3. Okay, so strong naman po yung hands ni patient, both hands, same force. Kaya naman po niyang i-force yung hands niya and full strength naman po ginagamit ni patient. So that's good, that's her. No abnormalities as in like weakness po sa hands ni patient or shoulder. Then, we'll proceed by the palpating the elbow pain, edema, temperature, and punctures. Relax na po kayo, sir. Do you feel any pain, sir?
Not much. Hindi.
Other hand. Polycranal side po yung pinapalpate ko. Feel any pain, sir? Okay, for the palpation, no pain naman po naramdaman si patient. Yung wala rin pong heat or edema na naramdaman or nodules po here, banda. Then we'll proceed by assessing the elbow for range of motion na po. Sir, I want you to do the up and down lang po. Tayo po kayo, sir. Nang dapat stay. Tayo po kayo. Up hanggang umababa niyo itong kabila. Kaya niyo po. So, flexion and extension, kaya naman po ni patient in a normal form. Hindi naman po niya, wala naman pong pain during the activity.
Wala.
Okay. So now, sir, we proceed by table. Left sir. Proceed po tayo sa pumo kayo, sir. Then we'll proceed by the pronation and supination of the palm. Here's the table, sir. Ganun yun lang po, straight. Ay, baba. Then, lagyan niyo po yung hands nyo. Then, ganun na po. Yung penetrate po.
No.
The other po. So, kaya naman po ni patient yung full 90 degrees sa pag-rotate ng hands, which is goodness, sir. Then, we'll proceed by inspecting the joint and wrist for the hands for symmetry, alignment, the numbers of the digits, and compare bilateral. Will any pain, sir?
Yeah.
Okay. 5 digits naman po na, sir. 10 fingers are aligned to the wrist. Then the other hand. 1, 2, 3, 4, 5 digits naman po. Pain, sir.
Wala.
Align naman po yung hands. Goodness, sir. No missing fingers naman po or any nodules sa constipation. Then we'll proceed by palpating each joint for the wrist and hands for surface. Masalat po, sir.
Hindi.
Smooth naman po siya upon palpating. And the wrist. Okay, sir.
Hindi.
And the other hand. Ayan, up. As here, smooth din po yung constipation and no nodules naman po. Then we'll proceed by assessing the muscle strength for hands flexion. Here, sir, is hawak niyo po to, then i-force niyo po siya pataas. Okay? Ay, baba siya. Yeah, 1, 2, 3. Bababa po siya ng 1, 2, 3. Okay? Then the other. 1, 2, 3. So here, sir, lagay niyo po yung hands niyo dito sa surface ng table. Then, ipupul ko po siya pababa. Dapat na-force niyo po. Okay? 1. Ano na? Straight. 1, 2, 3. Okay, sa other hand po. 1, 2. Okay, naman po the patient. May grip naman po sa strength yung hands ni patient, which is good. No abnormalities of skin like muscle weakness po. Then we will assess the motion of wrist, flexion and extension po. Gano'n naman. Baba, sir. In the other hand. So, okay. Full 90 degrees naman po yung kaya ni patient and 70 degrees. Then we'll proceed by ganun pa. Stop pa. No. 1, 2, 1. Straight po siya. Then 1, 2, 1. Sakit po ba? Straight lang. Sakit po ba?
Wala.
Other. 1, 2. Sakit pa?
Wala.
Okay. So, we'll proceed by ganun pa. Let's go back. And, here. No pain, sir?
No.
Okay. So, no abnormalities have seen naman po sa range of motion ni patient. Then, we'll proceed for the fingers naman po. Abduction and adduction, sir. Ganun. Ganun, sir. Dikit. 1. And then, this one. 1. The other hand po. Wala mo pong pain.
Wala.
Then, I want you to wrist. Grip niyo po yung hands. Full naman po yung grip meditation. Then, proceed by this. Move niyo po yung pagana. Thumb niyo. The other hand. The other finger po kaya niyo, diba? Isa-isa po. The other. Yung left. Abnormalities have seen po like pain or weakness sa pag-grip po ng patient. Then we'll proceed by assessing the carpal tunnel segment. Sir, I want you to do this one po. This is called Palm test. And stay po siya ng 1 minute. And tell me po if may masakit. Okay? 1, 2. Then, assuming the 1 minute is done, may masakit po ba meron naman, sir, or tingling here?
Hindi.
Meron po bang konti, or meron po bang naman kahit konti?
Konti.
Then, for pain po, may meron naman po ng pain?
Hindi naman.
Okay. So, no abnormalities have seen like pain or uncomfy, tingling. Then, assess the carpal tunnel syndrome. May masakit po ba?
Wala.
May tingling?
Hindi.
Okay, for the other hand. Hindi po ba nabibigla yung kamay niyo? Like shocking? So, no abnormalities have been seen like pain or shocking motion sa hands of the patient and tingling. Then we'll proceed by inspecting the hips of the patient. Lower naman po tayo. Lower body. Here po. Pagtalikod po kayo sa akin. Check po natin yung hips of the patient naman here. Okay, the hips of the patient naman po is symmetric, which is same size. Hindi naman po siya different from the other or same lang po siya with the other. No abnormalities have seen like asymmetric. Then we'll proceed by the lower body, hip, straight, knee, and feet. Sir, I want you to straight down po. Lay down, sir. Okay. Paganyan mo. Okay. So straight. Yeah, then. Then lower this one. No, the other one. Then hold mo lang here. Masakit po ba here, sir? And for the other hand po. Masakit po ba, sir? So, here po, bilateral naman po. Yung bilateral symmetric naman po yung hips ni patient is stable naman po and no pain at all, sir.
No.
Okay, so we'll proceed by assessing the hips, knees, and for range of motion. Straight nyo lang po yung hands nyo, sir. Ay, yung paa nyo. Here. Straight. Straight. Then, I want you to do like this, sir. Sakit po ba? Kayo po mag-anas, sir. Kayo po bang itaas? Kaya niyo ba? Okay, then next. The hand, the center po. I pa.
Mm.
Okay, so the patient is din po niya kayang i-totally up yung hips niya, which is sutra niyo po. Then here next is the taas niyo pong ganun. Okay. The other. So, good naman po yun. Ano abnormalities up? Like pain, sir? No, wala naman po.
Wala.
Weakness po ba ng muscle nyo? Kaya naman po, di ba?
Mm.
Then we will assess the hips. Then we will proceed by no, huwag po kayo gigilid. Sakit pa? Your feet. One, two. Sakit pa?
Hindi.
Then, open nyo lang po. Kaya pa. Kaya nyo naman po.
Mm.
Sabi yan. Kaya nyo naman po. So, kaya naman po natin a full 30 degree. Then, we'll proceed by the... Sir, kaya po kayo na, sir. Sumo kayo dito. Okay. Sorry, ma'am. Dito po na. Nandito po siya. Then, extend nyo lang po pataas to. Pataas, sir. Kaya nyo po. Then, the other hand. Then, yung third feet. So, kaya naman po ni patient. Itaas yung feet niya. No pain, sir. Muscle weakness.
Hindi.
Okay. So kaya na po kayo, sir. Ibig na po kayo pagsukay. Balik po kayo sa harap sa akin, sir. Po kayo dito. Balik pa kayo dito, sir. Okay. So, assess naman po natin yung nerve root compression nyo. Tataas ko lang po yung feet nyo. Okay, sir. No, huwag niyo pong i-push. Push. Back. Back. Other feet. Up. So, kaya nyo naman po, like may tightness po pa na tight naman po yung feet ni patient and yung hip niya or your hamstrings is repeatedly po or repeated but not yung hamstring po ni patient is has a has a strength and no pain po na, sir. Okay. Then we'll proceed by assessing that for structure naman po. Sir, I want you to do it here po, lower here. Then baba niyo po yung paa niyo dito. Baba ka dito. I-swing mo yung paa mo dito sa edge ng bed. Yan. Then, higa ka. Kaya nyo ba bang hawakan dito? Yung ninyo, kaya mo? Then, like, this one lang. Hold mo, tapos pull. Knee. Okay. Other foot. Okay, so negative naman po si patient sa Thomas test. Hindi naman po umaangat yung hip niya. Hip siya. Hindi po siya umaangat. So we'll proceed by the assessing the hip for muscle strength. Sugot po kayo ganun, sir. No, usog po kayo ganun. Sugot ganun. Then, paharap, sir. Okay, here. Then, i-raise nyo po ito. Then, ibababa ko po yung taas mo nga. Raise it. Then, bibigyan ko ng force pababa at ilaban mo. 1, 2, 3, go. Okay. For the other foot. As, then, ay, sorry. Ito po. Kaya naman po ni patient i-force yung muscle niya. Kaya naman pong i-force ni patient yung pababa, which is good, sir. No abnormalities have seen. May pain po ba, sir? Okay, then we will inspect the leg muscle for symmetric exercise. Using a medida po. Ito po kayo dito sa panging position. Then a medida. Using a medida, i-measure po natin. Okay. So, same naman po yung size ng legs ni patient, which is good. No, symmetric naman po siya and no abnormalities have seen like atrophy or twitching. Baba natin yung medida. Then we'll proceed by assessing the leg for muscle tone. Now, sit po kayo, sir. Ay, nakahiga po kayo, sir. Then we'll proceed by we're in konti na lang po, sir. Now, lalagay to find position, lalagay po natin yung hands ko with toes, ankle and knee. Looking on the may sakit po ba, sir? Masakit po ba? Okay, so yung muscle tension po slightly, yung muscle tension case, sir, is present. Then wala naman pong any passive movement during the assessment. Then we'll proceed by assessing the leg for muscle strength. Now, sir, here, sit lang po kayo dito. Konti na lang, sir. Now, sir, with the straight niyo po yung knee nyo, then magbe-bend po kayo sa knee nyo. Okay? 1, 2, 3. Bend. Bend po kayo pa. May naramdaman po ba kayo sa knee part nyo?
Ikal.
Okay, that's normal, sir. Nipple. Then, for the tricep, extend nyo po yung knee nyo. Then, taas nyo po siya there. I-force ko po siya pababa. Dapat palaban nyo. Okay? 1, 2, 3. Okay, and the next. Okay, so equal naman po yung strength sa knee ni patient, which is good na, sir. No abnormalities have seen, or kaya naman po niya i-flex or i-grip yung force. Then we will inspect the knee for asymmetric alignment. Tayo po kayo, sir. Okay, so po kayo, sir. Then we will inspect the knee. Align naman po siya. No abnormalities have seen. Naka-align siya sa tibia and ankle symmetric. May pain po ba?
No.
Okay, naka-align din po yung sa tibia. No presence of bowelage and knock knee. May masakit po ba, sir?
Wala.
Okay, so straight po siya nakatayo kanina, which is good, sir. Normal naman po yun. And no abnormalities have seen. Then we'll perfect for the contour. Okay. Straight niyo po pa here, sir. 90 degrees. May pain po ba?
Wala.
So, yung knee is smooth naman po. Ay, see, sir. Then, firm naman po yung knee. I put it here po. Same as here na, sir. Firm naman po and smooth. Then we'll proceed by assessing the knee for diffusion. Higla po kayo, sir. Higla po kayo. Then we will do a bulge test po. Check po that if present po siya. We'll do here. Nalagay po natin sa mini patient which is here next. May pain.
No.
The other. Wala naman pong sign ng bulging sa nini patient and no sign of milking as well. Then we'll proceed by assessing the range of motion of the nini patient. So tayo na po kayo ulit, sir. Then I want you to do, taas nyo lang po siya hanggang kaya, nodded baba. Hanggang sway nyo po pa. 1, 2, 3. Huwag nyo po hawakan. Sway, then up, pagpatakan. Okay, then the other feet. So, kaya naman po yan ng 120 degrees. Yung pag-flexion, then extension po. Hyperextension po ni patient or the like that is may mga 12 degrees. Then we'll proceed by assessing the T for stability.
Ganyan.
Kaya po. Konti na lang po, sir. Go po. Here po ulit ako sa mini patient. First is, check po natin yung lateral knee stability or lateral collateral ligament. Ilagay po yung hand sa medial aspect ni patient. Using the other hand, isikikip natin siya pag-move. Then yan, adapt natin. yung lower leg. Okay, sir. Hindi naman po gumagalaw, which is good. And wala naman pong movement unilateral to and midline, which is good, yes, sir. Then the other hand, okay. Okay, up. So, good naman po siya. No abnormalities have seen during here. Then we'll proceed by assessing the knee for meniscal damage here. We will do a McMurray test. As you po. As you na po. Ganun. Masakit? Okay, so may slightly pain po yung nararamdaman si patient. And wala naman po akong narinig na clicking sounds during the McMurray test. Then, pain, slightly pain and its maneuvers. Then we'll proceed by inspecting the ankle for feet, for contour, number of targets, and pain. Okay. Ayan po number maladies na nakikita in the ankle of the patient. So the ankle of the patient is smooth. Number of toes is good naman po, 5 toes. And no missing naman po. As long as the other foot. Then we'll proceed by inspecting the ankle. Wala naman pong signs ng any hallux vulgar or yung pamamaga sa gilid or pagdidikit. And no amputation naman po na nakita. Or wala naman pong amputation nangyari kay patient, which is good. Then we'll proceed by palpating the ankle. Feet 4.4. May pain, sir?
Wala.
So, wala naman po nakita any redness, any lesions sa feet ni patient, edemas, nose, larynx, up. And yung feet po ni patient is smooth. Yung feet po ni patient is smooth to touch, which is good. And firm din po yung muscles. Then we will assess the range of motion. So, itaas ko na lang po yung pakiminute. Then, I want to put, sir, up, down, up, down. Yung paa, 1, 2, up, down, up, down. Then, pagilid ko. 1, 2, 3, 4. Then, inversion and reversion. May pain po ba? For the other foot po. Up, down, inversion. Then, okay. May pain po ba? Okay, no pain at all, sir. So, sa pag-check po na yung range of movement ng patient, no pain, kaya naman po niyang kaya naman pong galawin ni patient yung paa niya in her own. And good naman po yung range of motion ng feet ni patient. Then we'll proceed by assessing the ankle for feet range motion. Now, sir, yung ankle niyo naman po. This one, sir. Ano niyo po? Ayun po. 1, 2, 1. Then, open closure po yan. Gagawa niyo naman po. And open, close. So, nagawa naman po ni patient sa ankle and yung yung abduction, then the flexion and extension. So, good naman po yun. No abnormalities have seen. Let's proceed by the muscle strength na po na, sir. For the muscle strength, sir, mag-a-apply po ako ng pressure pataas po sa hands, ay sa feet nyo, okay? Then, bababa nyo lang po siya forcefully. 1, 2, 3. Okay, malakas naman po yung grip ng feet ni patient. Other. Okay, so full naman po yung strength ni patient and kaya naman po niyang i-force yung feet ko, ay yung hands ko. Then, so, that ends my assessment in the musculoskeletal sir. So, natapos na po tayo sa pag-assess. Do you feel any pain po ba just now?
No.
Do you have any question po ba? Okay, so that's all, sir. I will proceed with the aftercare and hand hygiene. Then, have a great day, sir, and have a good day.